Peter Slavin. I'm the president of the hospital, and I wanted to welcome you to this wonderful celebration of 30 combined years of the Center for Community Health Improvement and the Disparities Solutions Center. We are honored that in about 15 minutes, the mayor of the city of Boston will be joining us. But with us right now is Vicki Kennedy and our keynote speaker, Dr. Garth Graham, who have joined us to celebrate this wonderful occasion. And please help me thank them for joining us. As president of this hospital, I am proud of many things that go on here every day and night. I'm certainly very proud of the clinical care that we deliver to our patients, proud of the research that goes on trying to come up with better answers for our patients and their families in the future. And I'm also proud of the incredibly talented young people that we attract here every year and the great training that we provide them in all the different health professions. But today we're here to celebrate something different, something that I think is one of the best kept secrets of this hospital, and that is our commitment to community health and our commitment to addressing the issue of racial and ethnic disparities. We know that there are significant differences in health status and outcomes in this country and here in Boston and here in this local community. And these disparities in care are based on race, ethnicity, social, and economic status. They affect how long people will live and the quality of their lives. And these disparities affect individual patients and entire communities based on their demographic. It isn't enough for us to say that we provide the very best care, research, and teaching if the benefits of this work aren't shared equally among all of our patients and the communities that we serve. And I know that you have all heard me refer many times to this letter circulated by our founders in 1810, when in distress, every man becomes our neighbor. And the modern day interpretation of that charge is that every man, woman, and child in Greater Boston is our neighbor and deserves good health and the ability to live in healthy communities regardless of their race, ethnicity, socioeconomic status, or other demographic factors. And that is why I'm so proud that 20 years ago this hospital had the foresight to found this Center for Community Health Improvement, led for those 20 years by Joan Quinlan, to partner with our neighboring communities of Revere, Chelsea, and Charlestown, where we have had community health centers for more than 40 years, as well as work with the city of Boston to address some of the underlying causes of poor health, such as educational attainment, substance use, and access to care. And in 2005, we were very moved by the Institute of Medicine's report that said that access to care is critical, but not sufficient, to eliminating disparities in healthcare quality based on race and ethnicity. And we were fortunate to create the Disparities Solutions Center under the leadership of Dr. Joe Betancourt. And this center remains the first and only of its kind in the United States and has become nationally recognized for its important work both here and across the country. So the work of both CCHI and the Disparities Solutions Center has really had a profound impact on the culture and the care of this institution, and on our work, and the work of these institutes and centers has led to several national awards for this hospital. In 2007, under the leadership of our board, the MGH trustees affirmed this institution's historic commitment to the community and to our commitment to equity by modifying our mission statement so that in addition to referring to patient care, education, and research, it also says, and I quote, our mission is to improve the health and well-being of the diverse communities we serve. And this was not just lip service. The board took this very seriously and has integrated this charge into the governance structure of the hospital by forming a community health subcommittee, which is chaired by Patty Ribicoff and Colette Phillips. And I know that Patty and Colette are here with us today, and I want to thank them for their leadership. So while the theme of my remarks has been one of pride in our accomplishments over the last 20 years, by no means do we want to sit on our laurels. We need to be as motivated and aggressive as ever, because obviously, although we made a scratch in the surface of some of these issues remain very big challenges for the patients and the communities that we serve. There is still tons of work to do. This great institution has been here for more than 200 years, and I know I speak for the board and leadership that we remain committed and will redouble our efforts over the next 200 years to make even further progress on these important issues. But from the communities we serve to the bedside in our hospital, we want to make sure that everyone, regardless of their background, has the opportunity to live a healthy life in a healthy community. And again, I want to thank Joe and Joan for their leadership in helping us make significant progress in both of these areas, and thank all of you for your support as we go forward.